no, please don't stop any medication or change the dose without first talking with your healthcare provider. You were placed on that medication for a reason. And so you want to be sure that you are not jeopardizing anything by changing the dose or by stopping the drug. Never, ever do that on your own. My goal for my patients is always to, the less is better. Not because I think drugs are bad or evil, but because if we can solve things with the way we live, it's a much, much better approach than camouflaging, what we're doing with a bunch of drugs, right? So the fewer drugs, the better. But please don't embark on, self-reducing medications, because they were, you were put on them for a reason. Now, in terms of, what can happen is that when you eat step 1 foods, you may find that cholesterol levels go down further than they got to when you were taking the medications on their own. And under those circumstances, it may be very reasonable to discuss with your physician whether or not it would make sense to reduce the dose of statin that you're on and then recheck. But you should do that quite methodically, right? So if you're making a change, test the result, test the outcome of what it is that you did. So the other thing I should mention is that there are some people who should be on statins, if possible. I mean, they have to be able to tolerate them, right? But some people should be on statins regardless of what their cholesterol numbers are, because the data, and I really believe in following the data, right? Because the data shows that if you are on a statin and you're in this cohort of patients, that you will benefit from a risk perspective, right? And really, this needs to be emphasized. We put people on statins not to make their cholesterols perfect, right? But to reduce their risk of having a cardiovascular event over time. So it's about risk reduction. It's not about cholesterol reduction. The cholesterol reduction is a means to the end, not the end in and of itself, right? So people who have so going back to risk, people who have known coronary disease, so you've had a stent, you've had a heart attack, you've had bypass surgery, you flunked a stress test, right? So there's evidence of atherosclerosis in your body. You've had a coronary calcium scan, and your calcium score is far ahead of what we predict based upon your age and gender. Okay. We consider you to be higher risk, and those individuals, like I said, in studies have been shown to benefit from being on statins for risk reduction, even if they start out with normal cholesterol readings, right? So remember, this is not necessarily about cholesterol alone, it's about risk. And here's another really important thing to keep in mind. The reduction in risk from cholesterol lowering from drugs is not nearly as great if you're only doing it through drugs, as opposed to a comprehensive drug plus lifestyle approach. Okay, that lifestyle, changing lifestyle, improving diet especially, potentiates the risk reduction from statin medications. So it's really it's really the combined effort, especially in those individuals who are clearly in a group that benefits from being on statins. It's not just about getting your cholesterol number down to a certain level. That's important. But it's how you do it, right? And if it's drug alone, not as much risk reduction as if it's drug plus diet.